Welcome to CityWise. I'm your host, Tiana Stevens. CityWise is produced by the City of Rochester to shine a spotlight on city living at its best. The School of Nursing at the University of Rochester Medical Center is exploring ways to help those caring for loved ones with dementia manage stress and improve their own health. Dina Johnson is a human subject research coordinator, and Kathy Hefner is a principal investigator at URMC, and they're here to tell us more. Thank you, ladies, for joining us.
Thank you.
So specifically, we're talking about two studies being conducted at the U of R. What was the motivation behind developing these studies?
So, we were really driven by a large body of research that shines a light on the health toll of caring for a loved one with Alzheimer's disease or dementia. We know that the stress of caregiving can affect caregivers' health by increasing risk for infectious illness as well as chronic disease. And we also know from a large body of work that caregiving stress can actually impact the health of the immune systems of caregivers. And so we were really interested in trying to understand more about those relationships, but more importantly, to develop interventions that may help reduce the health costs of caring for a loved one with Alzheimer's disease or dementia.
And Dina, who are you looking for to participate in these studies?
Caregivers that are 60 to 80 years old, ones that live in the home and are taking care of their loved one, and they might feel a little bit overwhelmed or stressed, and that they'll be able to see that this may be helpful in the future.
How do you expect this research to ultimately help improve a caregiver's overall health?
Well, our hypothesis is that if we can use these behavioral interventions to reduce stress, that this will also help promote emotional well-being in the caregivers. And by reducing stress and promoting better emotional health, then we hope to see that this will actually improve the way their immune systems function.
And Dina, how does the study actually work? Do people come into the office? Do you guys come out to the home? How does that work?
So both. So that's the great thing about this study, that we can go to your home so you don't have to leave, or they can come to the School of Nursing and we have a lab and we'll conduct our study there.
And what sort of things should people expect to do? Testing, paperwork, or what's entailed?
Yes, when we visit with the caregivers, we ask them a lot of questions about their own emotional health, about the stress, about the time they spend caring for their loved one, and we are really focused on the caregiver. So we won't ask questions of their loved one. All the questions are directed to the caregiver, and we visit them, or they can visit us if they so choose. Early in the study, and then they engage in the behavioral interventions, and then we'll assess them following that intervention period for a period of time.
Okay. What do you hope to, what are your measurable outcomes for the studies?
So we're primarily interested in whether or not these behavioral interventions, and I can talk a little bit about what those are, but we're looking to see whether these interventions help caregivers manage stress, as I mentioned, and also improve their own emotional health. And then our primary outcome are different markers of how healthy their immune system is functioning.
Sure. And Dina, you've had some experience of your own caring for a relative. Can you share about that experience?
Sure, yes. I was taking care of my aunt after my mom passed. It pretty much passed on to me because I was the only family. However, I have a husband, 4 kids. I was in school at the time and working part-time. So the becoming stressed and overwhelmed became a big part of me. Even though you try to show your loved one you don't want to be stressed, but it consists of me leaving my family for a day or two to make sure my aunt was taken care of, going back and forth to the hospital, and making sure I would find someone to help cover while she needed care if I couldn't be there.
Right. What other resources might have helped you during that time to manage the stress of caregiving?
If I would have learned about a lot of the outreach programs that they have for seniors, if her doctor would have helped explain her disease, that would have been very helpful, because me explaining, she really didn't truly get what dementia was. And if I had more of so pretty much more help as far as with the churches and outreach. It would have helped me a lot with my aunt.
And Kathy, what can you share about, is this kind of the common experience that caregivers have? What have people been telling you?
Yeah, we're finding that a lot of times caregivers tend to become socially isolated, spending so much time, just doing the things that they have to do to provide care for their loved one, but then also to have responsibility for the home, and many are still working, and so it becomes fairly overwhelming. And there are a lot of community resources that are going toward helping caregivers be able to navigate all of the responsibilities that are required. What we're really focused on is trying to promote the self-care that caregivers are doing, because that tends to be, they mention this all the time, that they just don't have time to spend on their own health and trying to maintain well-being and wellness.
What do you encourage them to do?
Well, what we're doing in our studies is we're looking at a couple of various types of behavioral interventions that we hope can help manage stress. So in our one clinical trial, which we call the brain training trial, we're looking at, we're comparing different approaches to what we call brain training or cognitive training. So we're looking at things like computerized cognitive training, so playing games on a computer. We also are looking at how education and learning might help by providing online video education for folks. And then in our other trial, we are comparing various wellness programs. So we have one mindfulness-based stress reduction program that we're offering, as well as other wellness programs that provide education about health, as well as support for caregivers. So we're comparing these various approaches to promoting the caregiver's own well-being and their health.
Sure. Dina, what have you learned so far in this work that you didn't realize before?
That it's very much needed. I'm very excited to work with Dr. Hefner and our other principal investigator, Dr. Mohan, that you always hear about someone taking care of. Research is developed with someone that has a diagnosis, not necessarily one caring for them.
Sure.
And you never realize how much a person is stressed. And even though they might not really think they are, because it's their loved one, and you don't want to really show it, but it's a lot of stress to it. And just with a little bit of the cognitive games that she was explaining and exercising, it relieves a lot of stress, more than people think.
Dr. Hefner, are there other universities, hospitals that are engaged in this same type of research? What have you learned from looking elsewhere?
So, well, there is more attention being given to trying to develop interventions for caregivers. For people like me who've been studying stress and health for a long time, where you've learned a lot about how the stress of caregiving can affect the body and the immune system and overall health, but we haven't developed and tested really good interventions that will help change these outcomes in caregivers. So that's really what I see as an important movement that's happening, and trying to develop innovative approaches that take into consideration the amount of time that caregivers have, or how little time that they have to spend on these kinds of interventions.
Dina, when you tell people about this study, these two studies that you're involved in, what's the community reaction been?
A lot of people are very excited that something of this research is taken, it's involving, and it's becoming very serious out here with dementia caregiver studies. So they are really excited about the research.
Dr. Hefner, what challenges have you had in going about these studies?
I think our biggest challenge is we're really trying to be flexible with caregiver schedules and providing as much opportunity to work around all of the demands that that they have. And I think even trying to reach caregivers it's tough, because people are busy. So we're really trying to spread the word that we have these intervention studies going on at the university, and we are really encouraging people to give us a call and learn more about them, because it's important for us to have that kind of participation. It can really help us to further caregiver health.
Absolutely. You mentioned earlier community partners that are out there as a resource, and that you share that with the participants in the study. What are some of those community resources that people should know about?
So we've partnered closely with the Alzheimer's Association, and they certainly provide a wealth of resources to individuals in the community caring for a loved one with Alzheimer's disease. We've also partnered with Lifespan, and in particular, they've developed the Finger Lakes Caregiver Institute, which is a part of Lifespan that's focused solely on developing programs for caregivers. And so I encourage our caregivers and caregivers in the community to reach out to both of those organizations. And they've also partnered with the Alzheimer's Association to develop more programs in the community.
That's wonderful. Dina, what do you say when you are recruiting people for the study to, let them understand the work and the importance of it?
The importance of what stress. I kind of use too of how when you go to the doctors and anything that causes stress, they tell you to exercise, do different programs, but this really, I believe, will get down to different trainings and different things that you can do on your own once you're off the research, but just to take part of it, see what it's about, and see if it can help research scientists, our medical profession, go further with helping our senior citizens and helping people with caregiving.
Finally, Dr. Hefner, how long can someone expect to be participating in the study? How long does it run?
So when we enroll participants, the total amount of time depends on the trial. We have one trial where we have people enrolled for about a year. Okay. So we're assessing them 4 times across that year, asking them questions, and that would also include the intervention period. And then in our other trial, it's about 6 months.
Okay. Well, wonderful. Thank you, ladies, so much for coming on today. To learn more about dementia caregiver studies at the University of Rochester Medical Center, you can call 585-275-6835. You can also send an email to mindbody@urmc.rochester.edu.